Hi, dear listeners, and welcome back to Blush and Bloom, the podcast where we talk about women's health, self care, and everything in between. I'm your host, Gigi, founder of Asele, your space for cycle aware and preventive care. I'm really glad you're here with me on this journey to unpack women's health and highlight the incredible things being built in this space. So let's get into today's episode. Hi, Bose. Thank you so much for joining me on the Blush and Blue podcast. So, for someone who's meeting you for the first time, how would you describe yourself and the work that you do?
Thank you. First of all, thank you for reaching out to me and inviting me to this beautiful podcast. I'm really happy for the work that you're doing and always happy to chat with other women in the same space. Yeah, so my name is Berabose Aline Joyce. I go by Bose, and I am a FemTech entrepreneur and wellness practitioner, and I lead a FemTech platform called Luna Health, basically helping women access sexual reproductive health products and services, although or in their journey from period into menopause. And we also run a healing and wellness center in Kigali, Rwanda, providing mental health and wellness services to mostly post-genocide generation population and reimagining how health and wellness currently is grounded. And so that's the kind of work. And then I'm very excited to be here.
I'm very excited to speak to you. And when my ears just like perked up when you said post genocide, how has it been supporting those people?
I mean, it's a learning curve experience. I mean, our focus is to be able to not only break silence and stigma around mental health and wellness services, I think, but also how our communities talk about hardship, issues, trauma. And so it's been just a learning curve, especially as a young entrepreneur. If there's anything being an innovator has taught me is, always being able to respond to whatever challenges. I keep thinking about a conversation I had with another entrepreneur, and they were like, you just keep picking the biggest issues and challenges. And I'm like, isn't that the job of being an entrepreneur? So once you dive into a different sector, more things come up. But it's been overall amazing because I'm very passionate about the work that I do. I've worked with women for over 3 years during my platform, but I've always been an advocate for women's health. So to be able within the last, I guess, year to serve a population beyond Rwanda, beyond women, beyond Rwanda as well, and to really contribute to the shift that is happening in mental health, wellness, and health is my pleasure. It's an honor.
That's really exciting. Okay, and also very, very impressive. So, what sparked your interest? I mean, you already touched about this a little bit, but what particularly like sparked your interest and passion for this kind of work, like for supporting women and people through sexual and reproductive health? And the question I already asked you, like, what drove you to this point?
I think for me, like women's health, particularly sexual reproductive, anything in regards to sexual reproductive health journey always feels very passionate to me because as a young girl, when you're growing up, you're trying to learn about yourself. I think the first experience every girl to womanhood goes through is menstruation, right? And you're always very surprised about the silence that is there. So many unknown things, even for simple things such as hygiene and products, right? And there's issues like period poverty surrounding from like a very young age and different population. So I've always been very passionate about that, just simply because of my personality. I don't like anything that is super taboo and silent, especially when it affects health and when it comes to women's sexual reproductive health. A lot of us suffer in silence because of that. So when you look at women's health conditions such as PCOS, endometriosis, period pains, even popular issues like period poverty, it's all like under the conversation of like the silence culture that is, crowded by shame and stigma and limited choices that prevents women from seeking help or having conversation about that. So when I was around 13, I remember I started, in being involved in like volunteering work. And then I started working for this organization that was, asking us to be trained so we can do peer sex education. And I was so excited to do that. And my journey basically begins from there, is all I'm saying. And now here we are, running a women's health bit. I've really moved from different parts of work, from advocating for women's health, running focus group, teaching sex education. I have done campaigns around free period poverty. I've done run different organization and consulted different organization always in sexual reproductive health. And I think maybe to close it off, like what I think why the reason why I ended up on women's health platform specifically was just seeing the huge long way that women have to walk through in order to figure out everything. Like when I was in sexual reproductive health as an advocate, I always envisioned the biggest issues to be around teenage pregnancy, safety, sex education, and etc. And then the more I grew up, the more I realized that there's more, right? There's more women's health illnesses, all the way even when women are going through menopause, even post-menopause. And I was like, oh my God, there's the whole spectrum of things that we don't know
Yeah.
and then we don't talk about. So and I was
Yeah.
like, I dedicated myself to be like, I just want to focus on our what I call the rites of passage of women, and for us to be aware of it and to learn about it and to know that it's a whole different phases, and with different phases come different challenges, and we need to know what are our options, what are services there, what are the products available.
All right. Thank you so much for sharing that. I think even more so coming from an African perspective, because like you said, these are very much taboo topics. So I'm really excited that you're doing all this work. And it seems like you already like answered the next question I was going to ask you, because I was going to ask you like, how did you move from diplomacy to all the way to women's health? But then I think you
Mhm.
already answered that in a way. And I love how you're able to like share all these different experiences that you've had and how everything just came together for you to build out Luna and all the other things that you do. So that's really, really cool.
Thank you
Okay.
so much.
And can you share moments like during your activism that made you realize that there's so many gaps in women's healthcare?
Oh my God, there's so many. How long do we have? Well, I would say that obviously my first one exposure is period poverty for teenage girls. And it's such a very like my first project that I was really keenly passionate about. And through my advocacy journey, I've always had soft heart for teenage pregnancy and the way that it's handled, and also seeing even living in a country that has such a great policies and great strategies in terms of women representation and women's right policies, the numbers kept increasing, right? And then the problems are not being addressed correctly. But one that I wanted to share with you is a couple of years ago, since I was a teenager, like every time you're growing up, your menstrual cycle or your experiences as a woman changes, right? So my personal story is that even though I was a peer educator, even though I was an advocate, I was experiencing different issues by myself, like heavy period and severe menstrual cramps. And I was like, this does not make any sense. Like, I just could think about it, and it didn't make sense that this is our realities, my reality as a young woman. But I was so surprised on how it was so normalized between me and my friends, my female friends, but also a conversation with my mother, right? And then I just came to accept it, right? So I moved from one painkiller to the other painkiller to the other painkiller until I was almost hitting my 20s, and was like, this is too much, because I was getting really destabilizing pain, and I was getting like severe heavy periods. So even though I had access to a medical doctor and I've gone to different gyno visit, eventually I found I was advised like I need to find a woman gynos. We don't really have a lot in Rwanda. I'm not sure that it's the same in every country. I know that some countries have more women gynos. So when I say that we really have scarcity of female gynos in Rwanda, they don't understand. But it's among like 130 different gynos that are in the country. There's very few, like 5 now. But back then, it was really rare to find a woman gyno. But I was recommended to this doctor, and I went to see her, and then like talking to her about what I've been experiencing for a very long time. And she was like, oh, like you might have some underlying issues, because the type of pain that you're experiencing, but also this, level of heaviness is not normal. And I just remember thinking, like, this is the first time, literally the first time in my life as a woman, as a girl, that I was told, like, the amount of pain that I was going through was not normal. So I just cried. completely. And that moment really changed and pivoted my life that have led me to start Luna, because I want more women and girls, whatever condition that you're going through, either if you have PCOS or you have endometriosis, or I don't know, you're dealing with fertility. It's only when I started the company that I realized that women undergo like so many different difficult issues that we don't talk about, because like our bodies are just, polished, and there's so much around that I talked about. So I created this platform just simply for women to feel like they have a place where they don't have to feel like they're crazy, and they don't have to feel like they have to pretend or hide or stay quiet, and that we have a right to complain, to experience what we are experiencing, and to ask for better services, better healthcare, all of these things. So that moment is literally the reason why Luna started, and what has led me to this moment, and what continues to fuel me to run this company.
That was I don't even have the adjective to put here. That was something. And I'm happy that you also shared this experience. I'm happy you felt seen, and you're also supporting other women so that they also feel seen and understand that their pain is not normal, and they should speak out and be able to have that kind of support system. So that's really cool, and I love that you were able to like take this experience and build it and use it as fuel to build out Luna. That's really, really cool. I'm happy I muted myself when you were talking about the gynecologists not being that many, because I was like, eh? Okay, that was an interesting fun fact. Okay,
Yeah, it is very interesting. I was also surprised. I thought that in every country, especially in Africa, that there's more like women, male gynos everywhere. But like even my neighbors are in Kenya, right? And I went to Kenya. There's many women gynos, right? So it's not a
yeah,
really big problem. They might have like different gaps, and I was so surprised because here is still a really big issue to find women gynos, actually, particularly even finding Rwandan. It's like now a lot of different healthcare since we started, with many different advocates have tried to like bring women gynos, especially the ones from abroad, even to just fill the gap. Can you imagine? And that just says a lot about how for so long women's health has been forgotten or underserved and under researched, particularly in this system. Like when you talk about it, you're like, okay, how many clinics that actually specialize on women's health? And there's like, oh my God, very few. And even the ones you find is like private, and that talks about already the realities of what women have to experience on a regular basis. That
okay, let's talk about Luna. What? Like this, the more you're explaining how the system is there, the more I'm like, what? Wait, I don't know if I can't remember the numbers, but I think it's probably like the opposite in Nigeria, because I think we have like a good number of Nigerians, and then the Nigerian doctors are leaving. I think that's the case there. So this is an interesting perspective. And it also reminds me that when I say Africa, Africa is not a singular idea. African countries are very, very different with very unique problems.
yeah.
Okay. So let's talk a bit more about Luna. So why was it? So Luna basically supports women from first period to menopause. Who knows if there's something else after menopause that we are not talking about? But why is it important for you to design a tool that supports women through everything, and not just say periods and menopause separately?
I think for me, it's just the simple realization that women's health is not just a single event that happens when you like have your period. Because I feel like that's how people imagine it. This, like a woman have her first period, and then somehow some of them get pregnant and then give birth, and then they age somehow. But the more as I continue to journey in this life experiences, I realize that there's so much part of it, right? Even our cycle, each cycle is completely different,
Yeah.
it's completely different. And it's so hard for people, I guess, non-menstruators to imagine how that works, right? Even menstruation in itself, there's like a variety of issues that we have to have a conversation about, that about the hormones and how it affects our mood, and how it works, and the products and hygiene, all of these things.
Yeah.
And that goes to my biggest, what I was coming to realize is that women are having to reinvent themselves every stage of the way, and they have to figure out everything by scratch. And then in many African societies, including Rwanda, we normalize these things. Like when it comes to motherhood, it's like, oh, it would come, because it's like, it's once you become a mother, it's just gonna, happen magically. because we believe it's such a very obviously natural birth process, then it limits us from learning like what is actually a woman going through when she's pregnant, what are things for her to expect when she gives birth, what does postpartum talk about? And then until you see women who have gone through that and they are completely in shock, right? So if someone is experiencing postpartum depression, we don't know how to help them, we can't diagnose them, we don't know how to approach it, because all of these issues are under the coverage of like, oh, this is just women stuff, right? This is how women are. This is just how women behave or act, or all of this, and that contribute even the stereotypical conversation around women's bodies and health. So when I wanted to create an innovation, I wanted it to feel like that, to every woman to see themselves in what I'm creating, and to tackle certain parts of like how women are, their experiences, their issues and disease, and to honor a whole cycle of what being a woman is from your first bleed to your last. And that's why we continue to add different things, because every single time when we engage with different women, we get to understand who they are as individuals and what they're experiencing. Because other people, for example, will still talk about women's health and not bridge the gap to what it means to mental health. And then women's mental health is completely very different if it's woven into that journey. So I think that's what the creation is. I know it's a lot. Many people say it's a lot. Yeah. It's because being a woman is exactly multi-layered and multifaceted, and that's how we need to address it.
Yeah, I agree, especially when you brought up the part about mental health and how every cycle is different, because I think it's also easy to forget how mental health can impact a woman's cycle as well. Like if you're stressed, your cycle is going to look very different. If you're not eating the right way, if you're under eating or overeating, it's going to affect the way the cycle is going to present itself. And sometimes just being is enough for the cycle to just be like showing up today. What are you going to do about it?
Exactly. Or even like when people make jokes, like I think really understanding women's health also helps us inform like policies and conversation around that. Because when, for example, people make jokes about, women are just very moody and whatever, or if you are feeling less energetic because you're in your in your cycle, and then people are like, this is how women are just naturally weak, or etc. And I think those conversation comes from there are not enough conversation that talks about what being a woman actually is, especially in this system. So people make stereotypical judgment and boxes in certain phase. And I'm like, and I apply the same principle to what it means to pregnancy. I think I've never been pregnant, but the more I learn about pregnancy and learning what is happening in women's body and talking to women who are going through these experiences, that I'm like, I didn't know that this is what's happening. Like this could have happened to me, and I would have been completely surprised. And I think we need to push more open conversations about like what are actually women going through.
Yeah, I really like that social media is also helping with this a lot, because I think I've been able to learn a lot from social media as well, because it's like women opening up in comment section and you see like the most random thing about their experience being pregnant, and you're like, I didn't even know that was a thing. Like there's this, like a woman lost some teeth because of her pregnancy.
Oh my God, it's absolutely terrible.
I don't know if there's this like ongoing meme that there's this like woman who's compiling the long list of symptoms that happen to pregnant women. And she's like, yeah, if you ever feel like you want to get pregnant, refer to this list just in case you want to change your mind.
Exactly. I love that list. Honestly, we need more of those lists in all languages as possible, translated and distributed across the country. Yeah. Like when I saw the list, like there's so many things I learned, not just from a conversation. And I was like, other women have been lying to us, because what do you mean you lose your hair, you lose your teeth, you're pooping? Like that's crazy. Like nobody really talked about childbirth.
Then I think it's been packaged for a long time that it's a natural thing, so it's supposed to look a certain type of way, and forgetting that each woman's experience is going to be different from the next one. So some women can have like the easiest pregnancy, like some women can do a master's degree while pregnant, and then there's another woman who just can't get out of bed. So it's like, I love that we're having these conversations and being able to talk about all these things more openly. So fun stuff. And speaking of conversations and educating stuff, so while building out Asele, which is my own thing, I've noticed that like in the process of building, there has to be like some form of educational aspect of it. I think this applies to most products in FemTech anyway. How has the experience been for you with being able to, because I think from your website, I think you've done some outreach. How has that process been, like maybe approaching schools, students, talking to them about these things? How's it been accepted?
I think every levels obviously it requires a very specific approach, but I do love working with schools. We have worked with workplaces as well, but also a lot of it's also a lot of advocacy and policy change. And what we do, at least at Luna, I don't know if it can help in anyone, is like really building a specific program tailored to the type of like people that you're approaching, and most importantly to see how you can integrate culture. Like feel like sometimes as advocates, like you want to have a conversation about sexual reproductive health to young teenagers, and you want to go to workplaces as well, and you want to work with mothers, you want to do all of these things, and we forget that stigma and shame and guilt and all of that exists because there's so many other different systems at play, right? I think about it in terms of like, you know, we have a certain culture that prevents certain things and all of that. And not all the culture should be removed away from that. People have belief, right? And they have other, I guess, conditions that they subscribe to that informs the kind of information that they're willing to learn and expose. Like you see it mostly when it comes to women and sexual education, a part about pleasure that even if you're consulting to a married couple, they don't want to talk about that because you can see that the person or the couple is already subscribed to different other components that, preventing them from engaging with the solution you're providing or from seeking information and having, all of the things. So what I've learned over the years of designing programs and working with different types of groups and institutions and also providing these services and educating about it is you need to find a ways to bridge all of these parts and customize it depending on what group that you're working with. And I think that's the approach that kind of like normalizes these conversations. Otherwise, like I used to be very stuck and very, especially in the first year where I was like, I don't know how we're going to engage all of these institutions to teach about period or to teach about pregnancy, to teach about all of these things, right? And people exist in these communities, and I love communities. I love church communities. I love schools. I love home. I love workplaces. So yeah, that's over the time, like what I'm learning. How do we integrate and bring and invite these other systems at play in order to educate or to shift narrative and to provide services that we seek to provide. I don't know if that answers the question.
Yeah, it did answer the question. And I think you also brought into perspective like the importance of culturally relevant, at least in culturally relevant since I started like building on my own thing, but like culturally relevant solutions. Yeah, both were that for me at some point, but oh well. Really relevant solutions, because I love that you're saying this right now and you're mentioning how it's important to customize it to each and how it's even like different for married couples as well, because it's still like maybe a taboo topic or something. So I love that you're doing this and you're also understanding that like for some cultures it may be a bit, there's some things you can say, some things you need to reframe, use a euphemism or something like that so you don't offend anybody. So yeah, this is really cool stuff. I wanted to ask, like, okay, so in comparison, okay, I don't know, hopefully this doesn't come out wrong, but like in comparison to like other tools that are building for women in this space, how would you compare them to what you're building at Luna in terms of making it for Rwandan women?
You know what?
Yeah.
I think for me, like those are types of things that I'm trying to no, I don't have the perfect answer for this type of things because being a startup founder specifically, when I started heavily in the tech world and learning about femtech industry and like being part of different spaces and we would often be asked, what is your unique proposition,
Yeah.
what is something that you're providing and all of that. And I'm not that old, but I feel like for 3 years of running this startup, that I don't simply also think that I define as a tech startup period, because I have had to adopt and change to suit my context, my country, women that I'm serving. Like there's so many changes that you have to make over time that you realize eventually when you're looking at it and you're like, I don't know, like what is this? And what is the unique proposition? Because my unique proposition used to be, for example, I will tell you in my pitch, be like, we have a very AI powered personalized way for women to engage with, products and services, and for women to be able to assess their symptoms and conditions on our platform in order to get the personalized care, right?
Mm.
And that is something that was not in the market. That was a solution that nobody was providing, considering all of the problems that are there. I'm not sure that it is the thing that drives my innovation anymore. Like I'm more driven now to like really truly listen to what is something that can truly make impact with every woman who reach out to us. If they wanna, for example, if a woman reaches out to us and they're like, I wanna know what are my options for safe abortions in Rwanda, and they have no single information, and we don't provide safe abortion on the platform. How do you guide that person to know, like, hey, here is what here is what you can do. There's this clinic. Where are you located? And this is what you can do. If a person reaches out to you and they're like, I need a contraception. Is there something that you can provide me morning after? And then you're explaining morning after pill. You're like, this is how I have come to tailor my services as a response to women, a frontliner, supporter, and friend of women. And I really hope my innovation, whatever may be years down the line, that it continues to, I guess, be much more simplified in a way that it can become much more unique and much more presentable. And I'm saying this now because it's something, a realization this year that I've been that it doesn't have to be super different from everything. And then when someone says this, then they're like, oh, what a unique kind of very different things. Because I realized that when I went down to the people that I wanted to serve, really didn't matter if my innovation was like AI powered assessment or winning innovation. Just wanted to know if you can help me with this problem that I have. You understand?
Yeah, that makes sense. That makes a whole lot of sense because I mean, I'll say African, the Rwandan context would be definitely different from the Nigerian one, and it's important to meet the people where they are. That makes a whole lot of sense. Okay, so my next question for you is, you've talked about, I think I have so many questions for you and the time is almost up.
No, that's you know, I've piled every single thing in one question, one way or the other. If someone listens, they're gonna get perspective of who I am.
I mean, the point of the podcast is not for me to follow the entire script. So let me see if there's something that you haven't already answered. Okay, so I saw this question let's ask you just now. It was basically, I can't find it anymore. Anyway, the question is basically like, how do you see FemTech tools supporting African women and closing the gap where the healthcare system may not be able to reach?
I think that the answer is probably in the question. I think definitely the femtech industry is such a very innovative way to bridge the gap when it comes to reach. I'm a very tech enthusiast person, and I'm very impressed in the way the amount of information and details that you can get from AI powered system that is very different. Because I would like to say that I'm a victim of a healthcare system, an incomplete healthcare system, because of how when you consult a GP who do not understand women's health, who was not informed about anything, like, and we see it show up in stats rail. So lead diagnosis, misdiagnosis, all of these things, right? And I think technology plays a huge gap in bridging information, bridging accessibility, expanding reach in a very fast way that any humanly possible can do, or structural systematic growth can be able to do by themselves. Right? So I like that. And I think when it comes to Africa, the biggest challenge is still obviously to innovate locally, contextualize it. I feel like we're still stuck, and not just in the tech world or femtech world, any innovation industry, we're still stuck where, we follow certain European trends and then contextualize it. to African market, where I feel like, I don't know, it needs to be somehow reversed. Like, how are we, bleeding local solutions and local innovation? And I'm very passionate where a lot of local initiatives around women's health and sexual reproductive health for teenagers are they going to be in the digital era, in the tech era, because we already know on the grassroots there's a lot of people who are distributing pads, who are innovating different affordable, reusable products for the demographic and people that we work with. There's people who are helping traditionally women and villagers to count the purest. That is not just apps, right? Like the way you and I would know, like, oh, you have your own FemTech app, you have all of these things that you already use and you want to bring those solutions home. But I'm curious more like about the FemTech revolution in Africa that actually focuses on grassroots solutions that work for the people that people are using, and seeing how to integrate them or introduce them to the tech innovation world. I don't exactly know how that looks like, but that's just my point of view. That's my point of view.
When you described that, it reminded me of somebody I've had on the podcast before. She's building Mylora, and she's basically like educating. I don't know what I'm calling like I've been watching too many movies. Like a doula. I can't remember what it's called. But so basically, she has a platform that supports women, women, in Nigeria, in northern Nigeria, and she was telling me on the podcast how, or was it in a personal discussion? I can't remember. But basically, she was saying how like an app wouldn't apply here, that she has to go to, because these women already have women like midwives that they trust already. So if you're coming to them directly, they won't pay attention to what you're saying, because they would rather trust the midwife that they know that's their doctor, that's their former healthcare professional in that case. When you mentioned like this thing, it reminded me of her, because it's like she's not just building out her app, she's also like making the effort to like go to these communities, approach these women, and then the ones who can join on the app and use it. So it's a very different approach for us, I guess.
Yeah.
All right. So whew, we've talked about a lot of stuff. So all right. So what are your thoughts on what are your thoughts on femtech in general for African women? Like, where do you see, are you hopeful that the efforts so far are going to change things, or we still, I mean, generally femtech has a long way to go, but is there anything that you're particularly excited about that you'd like to see more of?
Oh my God. I mean, there's so many innovations that I'm excited about. I'm not sure that they're very specific to Africa though. Like, but me personally, like some of the femtech innovations that I'm very excited about is like I'm not sure I'm gonna say it. The English is starting to expire because it's already 5 years. But I think it's called the Specurum. Is it the Specurum, like the device? That, I've been very, very anti that for very long, but like seeing so many innovations that are being done, in so many different ways. I'm not able to like create devices. I'm not, that type of innovator, but I love engaging with femtech innovators that are doing different devices around that, tracking your fertility using, just something like a thermometer. Like there's so many things that I have seen with myself in the network and the communities that I am. And I'm like, when is this gonna hit the market? Because I need to use this. And I think I love that. But one maybe that just came to mind with is this innovator in Kenya that I have seen. And they developed like this little, as you know, like pregnant women, they have to go for at least 4 checkups and stuff to the doctor. And some of the hospitals and clinics are so far from villages, so the women end up not going for their health checkup things. So she's obviously, some of the people can buy their own devices because it directly sends information to the doctor clinic operating it, and then they can be able to tell them if they're well. So it's like a home, pregnancy visit, and I think that's very beautiful, that it saves a lot of time for women, especially when I saw it, when I watched a documentary of like this pregnant women working really long distance, to like go to the clinic. And if you have been to any, and I believe this is like a lot of African countries, to an African local community clinic, and there's a line and there's like pregnant women waiting there. It's just, it's not nice. If you love women and you're all for women, it's like we deserve better, you know? And
Yep.
so I'm excited for that. So, seeing that for me, like that is type of like technology and innovations I was talking about earlier. Like when an innovation is done by an African person for African women in the context of African problems, like it makes so much sense. Like you see the solution, you're like, this makes so much sense. Like because it makes sense, right? So yeah, I think that's what I'm excited to see how young people, specifically young innovators, I participated within the last 2 months, like this incubation that just started in Rwanda, specifically for FemTech innovators, really young Gen Z, young women innovating around women's health. And I could not wait for their solutions, whatever they're going to come up with, to 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 develop, because they're thinking radically. They have the trainings and all of that. So I definitely think that we're looking at a lot of change in the future when it comes to women's health, being driven by young innovators, young women, technology, and my personal, obviously favorite, as I mentioned, women gynecologists and women doctors. I want that more. I want that more for sure.
Hey, this is awesome. Thank you so much for sharing that. And I really like that Rwanda is supporting startups. I think like you guys have this whole like startup innovation hub and everything. So that's like really, really cool. So really exciting stuff, and happy to hear that Rwanda is doing good stuff. All right. So we're headed towards the end of the podcast now. So I am going to ask you like 2, 3 more questions
Mm-hmm.
since your English is almost expiring. So what would you tell 15-year-old you?
Oh my God. I think, I don't know the English word, but it's like, you know, like when you make yourself small.
Mm.
I feel like a lot of young girls are taught to shrink themselves and to look smaller and to, yeah, in a way, like not to appear bold and loud and crazy and over the top and overly ambitious. And I think if I met my 15 years old, and then a lot of my teenage years was that, trying to balance my energy, myself, with being an African Rwandan woman. And I spent so much energy around that. So if I could meet my 15 years old, I would be like, you know, like go crazy. Actually, I'm a big advocate for mad women now. I'll be like, don't even think about being correct or small or shy. Just go crazy, go mad.
All right. Thank you so much for sharing. I think that also speaks to me as well, because I was also told to like, don't be too loud, be a lady and all that stuff.
All that, all that.
Well, now I think the advice someone gave me is to be a sort of person, and they would be like, who does this girl think she is? That was nice. I'm happy I got that advice. It just like lives rent free in my head now. So what's next for you and Luna?
Wow.
Is there something?
Well, continuing for sure, scaring around Rwanda and beyond, possibly, and really driving impact in sexual reproductive health for women and mental health as well. And me personally, to continuing to break barriers around conversation around women's health. And I always like to see, especially as someone starting a company in this time and age, to kind of be like a connector between the future innovators, so the young women who will innovate in the future don't have to go through the same issues that we're probably facing now, such as like funding. But yeah.
I was going to ask you a question, but then I was like, let's just wrap it up. You know what the problems are.
Everybody always want to talk about fund. I mean, why not? Funding is a very important conversation.
Yeah, we can talk about that all day. I think that it comes up almost in every podcast episode because, as we all know, it's underfunded. So you can imagine, especially like, I don't even have the words. Okay, so for somebody who wants to learn more or say support Luna or any other initiative that you're doing, where is the best place for them to find you, find Luna, find everything else?
Me personally, please always feel free to reach out to me and connect with me on LinkedIn. Berabose Aline Joyce. Where our company is also available on LinkedIn, Luna Health. But we, as a, I guess, young led innovation, obviously social media is our only way. So Instagram, TikTok, and our website, and all of them, we're lunahealth.co. Look for us, reach out to us. Let's begin conversation. Let's talk more about women's health. Yeah, that's it.
All right, awesome. I will include all the links in the description and in the show notes.
Thank
So-
you.
Hi again. Thank you so much for listening to this episode of Blush and Bloom. I'm so glad you joined me for this conversation. If you found it helpful, please share this episode with a friend or someone who might need it. Let's keep talking about women's health and working towards better outcomes for all of us. You can find more episodes and resources at www.asele.tech and check out our app at www.asele.health. And you can follow us for more updates on Instagram at asele.tech. Until next time, I'll see you in the next episode. Take care and bye-bye.